when life decides to humble you, she's got it down to a pretty precision science. You know, when you go from running most 25-year-olds into the ground and you can't get up a flight of stairs, and I don't do frail very well. As we got down in the last several months, it became obvious that something was cooking, and amyloidosis, with Dr. Reichland's training, was it? Well, it was fairly gradual, but when it gets rocking, it rocks. It's a very insidious disease with no cure and no cause. So it was getting down to the wire where.
And fortunately, his other organs besides heart and kidneys was intact or only minimally involved. That allowed us to proceed with decision-making regarding heart-kidney transplantation, combined heart-kidney transplantation.
It's the weirdest thing to hope that somebody else's life is changed dramatically for somebody else's, but I've always been a donor. I've always been supportive of it. I'm beyond grateful for the donor, for their family, for their loss, and I can't even begin to thank the doctors. So, thank you.
Well, I think it's an important step because not necessarily from amyloidosis, which is, of course, a rare disease, but there are multiple patients around who have failing hearts and failing kidneys in some combination. And so I doubt it'll ever be a procedure that's by any means common, but to at least have the experience and to know that we have the ability to do it, I think is a huge step.
He was sleeping quite a bit just because he didn't have the energy to do anything. And then as soon as we get out of the intensive care the first day, he's walking around the entire unit. He would not have done half of that, maybe even a quarter of it before. And the fact that he doesn't, he wasn't swaying because you wondered if he was getting blood up to his brain, or, he acted like he was stable when he was walking. Was still slower, but my gosh, it's baby steps. You've got a long way to go and a wedding to get to, and
It's pretty amazing. It's pretty amazing knowing I'll get my father-daughter dance, so pretty cool.
I agree with Kara as far as the donor. It's, I'll be eternally grateful to them and, the whole family for their loss, and for the doctors here for stepping outside the box. It's not the normal treatment, and it's amazing the communication between all the different departments, between all the physicians, the staff, all for one thing, and that was to help him.
He was fortunate in the sense that his disease was limited to his heart and his kidneys and hadn't affected the rest of his organs, which really allowed us to proceed and go ahead. But it's also what makes this so rare is the transplantation for this particular disease, or with this sort of unified approach. And then when the bone marrow transplant is ultimately completed, we'll have cured the underlying disease as well as replace the diseased organs, which is why his life expectancy will be normal.
Well, it's pretty surreal. I've always tried to be fairly positive, and I'm not a statistician, but the odds of pulling off what happened they're not even odds.